It's my pleasure to be with you. The coronavirus is taking a heavy toll on the United States. Many areas are seeing a dramatic new spike in cases, and officials are taking steps to help curb the spread. In Louisiana, Governor John Bel Edwards ordered a statewide mask mandate on Saturday. It's set to go into effect on Monday. Bars will also now be restricted to takeout orders only. And in Atlanta, Mayor Keisha Lance Bottoms ordered the city to roll back its reopening plan to phase 1 after Georgia reported a single-day record for new infections on Friday. Under that phase, Atlanta residents will be required to stay home except for essential trips and wear face masks in public. Across the country, more than 3.1 million cases have been recorded, and there have been more than 134,000 deaths. Michael George has the latest details.
Bars, restaurants, and the young made their way into the crosshairs of governors of southern states where the virus is surging.
This executive order will prohibit the sale of alcoholic beverages at all South Carolina restaurants and bars after 11 p.m.
South Carolina Governor Henry McMaster threatened to strip liquor licenses from violating proprietors. At a Kentucky test site, bartender Michael Whitler knows what can happen after 11 p.m.
Once it gets too late at night, it's just unbelievable. It's been pretty nuts, enough to make you want to go get tested.
In Tennessee, Shelby County restaurants require customers to fork over their contact information before they'll be seated. Infectious disease Dr. Manoj Jain is on the local task force that mandated the rule.
I think it's really important to have people's names and phone numbers, because if there was someone who was positive in that restaurant at the same time, then the owners can tell everyone else.
Chef and owner Michael Patrick will hang on to the information and seating charts for the better part of a month to help trace patrons who test positive.
I would hate for, God forbid, someone to get sick here, but I would feel like it was a public obligation to let people know who ate here.
For some, crowded restaurants and bars are seen as a toxic cocktail. Then, when the young are added in,
many of the young people in our state, as well as around the country, seem not to be taking the virus as seriously as they should.
For months, many young people ignored safety measures, and others politicized the pandemic. The groundwork for breaking this week's case records was laid. A record-setting 63,200 new cases in a single day on Thursday. At the end of April, the one-day record was a little over 36,000, according to Johns Hopkins University. Florida alone had 11,000 new cases Friday, while Arizona has 1 in 4 people testing positive. While this week, too, the country's 3 most populous states, Florida, Texas, and California, reported their highest single-day death tolls. With Texas hospitals filling up, the governor, slow to institute safety measures in the first place, now stands for a state that's paying the price.
Things will get worse. The deaths that we are seeing, those are people who likely contracted COVID-19 in late May.
For more on this, I'm joined by Dr. Ron Elfin Bane. He's an emergency care physician in Maryland. Dr. Elfin Bane, good to have you with us. As we mentioned, coronavirus cases in the U.S. stand at more than 3.1 million, and many states have seen a resurgence in infections and hospitalizations. So what steps need to be taken to make these trend lines go down?
Yeah, it's very troubling, these numbers, that the fact that we're seeing this. I don't even want to call it a second wave because we never really got through the first wave, but we're seeing the numbers kind of go back up again. And I think part of it is because we've started to open back up, right? I mean, we've let people kind of go back to work. We're letting people mill about. Part of it is that people have been shut down for 3 months, and they're tired and they're frustrated and they want to go out and they want to have fun and they want to live their lives. And part of it is that people are getting complacent. They're not socially distancing. They're not wearing masks. They're not washing their hands as well as they were, say in the middle of May or June or early June. And plus it's getting warm out now. So everybody wants to go outside, go to the beach, go to the bars, go to restaurants and hang out and do things that are social. And, back in March, when it's raining, at least in the Northeast, it's raining and miserable outside. Nobody really wants to go outside anyway. So wasn't that bad. But now I think people are starting to want to go out and be with their friends and be with their loved ones. And it's a disturbing trend for sure.
Well, and that's exactly the case. I think coronavirus fatigue is a very real thing. I know that I'm over it. I think everybody in America is over it, but we still have the pandemic to contend with. So it doesn't matter if we're over it. So how should we be behaving? And how should our local, state, and federal governmental leaders be responding to the pandemic to try and really get this under control?
Well, I think that's a really good question. And I really think that you hit the nail right on the head. You said the federal, state, and local governments. And I would argue that the state and local governments are way more important than the federal government response, at least at this point in time. The federal government has done what it can, I think, to get resources to where they need to go. They certainly could have done a better job, and they probably could do a better job going forward. But I think that's always going to be the case. But I think the onus really falls on the local and state governments to really get their states to start behaving, if you will. I hate to use that term because it sounds very paternalistic, but on some level, we know what works and we know what stops the spread of this thing. So we should be pushing those things that help to stop the spread, wearing masks, staying socially distant, and doing our part as individuals to make sure that we are stopping the spread. And I think the state needs to kind of help reinforce that. And then the local governments need to help reinforce that. The other thing that the states and local governments can really do is help with the testing. I mean, the more tests that we do, the more people are tested, the less likely we are to spread it. Because if you know you got it, then you're going to stay home and self-isolate. So the states and the local governments need to do everything in their power to help. I own an urgent care, for example, and the state and the local government should be doing everything they can to help me test more people. We've tested over 6,000 people already on our one site. And honestly, we really haven't gotten much help from the state or the local government. And they could be helping, not just me, every small business owner, every urgent care owner, all the nursing homes, all the assisted living centers, the state and the local governments could be helping that tremendously. And at least in Maryland, they're really not.
Yeah. On that note about local, state, and federal governments, Dr. Elfin Bane, there's an ongoing battle between Georgia Governor Brian Kemp and Mayor Keisha Lance Bottoms of Atlanta. We mentioned that the mayor is rolling back the city's reopening to phase 1, but the governor criticized the move, saying it's unenforceable and that local rules can't be more restrictive than statewide mandates. Do you think local municipalities should have more control in how to handle this crisis in their individual cities, or is this something that really the state governors need to take more responsibility on?
Yeah, I think that's a really good question. And obviously, it's hard because you're not only crossing jurisdictional lines, people are crossing state lines, they're crossing county lines. It becomes very, very problematic and difficult. And then, of course, as a citizen, well, the rules are different. If I step foot, 5 feet into the right versus 5 feet to the left. So it becomes very problematic to enforce. That being said, I do believe that the local government really is the one that needs to step up in all the municipalities and all the areas, the counties, and really start to work together with the state and with their local neighbors, the other municipalities nearby and the local counties and things, to really kind of come to some consensus on what are we going to do and how are we going to do it, and most importantly, how are we going to enforce it? I mean, you can make a law that you got to wear a mask, but if nobody's going to enforce it, what's the point of the law? So I think the municipalities could really, on the local level, be working not so much in a carrot and stick way, but if my local mayor, for example, who I might have a relationship with, got on TV or got on the news or on the radio and said, hey, it's really important we all wear masks, and then shows up at the local baseball games and all that and explains why we need to wear masks to everybody, all of a sudden it becomes something that I want to do because my friend the mayor told me to do it. And then, I don't know the governor, for example, but if the mayor told me, well, I know the mayor or I know the county executive, or, as you get larger and larger in the hierarchy of government, you become farther removed from the individuals. So I think it behooves the local governments to really get with the people that they know and try to enforce these rules and try to get people to buy into it, because you're never going to be able to enforce it if people aren't buying in. And I think the buy-in is the key.
Sure. Well, I want to ask you about something else. The World Health Organization earlier this week said that the coronavirus may linger in the air in indoor spaces. How can people protect themselves from this risk?
Yeah, so this was very concerning, and it's actually something I've been concerned about for quite some time, and I've been talking about for quite some time, that the virus is probably airborne, even though the WHO has said that it's not. And they have 32 countries now and like 250 scientists or more, I forget the number, have come out and said, we believe that the virus is airborne. And the difference really is airborne versus droplets. So droplets are when you sneeze, the virus is contained in these big droplets and they shoot out and then they hit the ground. Gravity pulls them down to the ground, and that's where the kind of 6 feet social distancing comes from, that you have a radius of about 6 feet where these things will spread, versus airborne, where you have particles that just linger in the air for quite some time. And if you walk by, you breathe it, you're going to catch the virus. So how do you protect yourself from this? Well, number one, if you're going to go to a restaurant or something, eat outside. Number two, airflow. Fans, ceiling fans, box fans, opening the door, all these things can help because they create airflow, so that just pushes all that stuff outside. UV light also helps to kill the virus. So being outside in and of itself kills the virus. People can buy cheap UV lights that they can put in their homes that will help kill the virus. And then it's just a matter of airflow. So I would highly recommend, if people are going to go out for dinner, that they not eat inside. And if they are going to eat inside, make sure that the restaurant has adequate ventilation. The other thing, and that'll include HVAC, the heating and ventilation system, so to make sure that there's a constant flow of air and the fan is always on. If you're staying in a hotel or something, you can turn the fan on so that it's always running. That'll help kind of keep the airflow going and keep you more safe than you otherwise would be.
Well, I imagine that this new information from the WHO also impacts this larger debate about schools reopening in the fall.
Yes.
There are many people that argue that children have been largely spared the worst of the coronavirus. Can you talk about how frequently children are infected with COVID-19 and how the possibility of the virus being airborne might impact that debate?
Yeah, that's a really good question. I think we really need more research and more information on this. So the big problem with kids is that they tend not to manifest symptoms, and which is great, but we don't know how many kids become asymptomatic carriers. The data seems to say that not that many, but we don't really know for sure. And there is this disease, this inflammatory process that children can get where they get very, very sick basically after they recover from the virus. They generally don't get that sick from the virus, but then they get this post-infectious process that can become very, very dangerous. It's very rare, but it does happen. So that speaks to the broader question of when do we open schools and how do we do that? So there are products that you can put down. There's one product, it's called BioDefense. It's a liquid that can be sprayed, and it basically seals all porous and non-porous surfaces and keeps the virus at bay for, I believe it's up to 60 days. The Global Virus Network has come out in support of this product. It can be sprayed down and basically keeps all the surfaces safe so that you don't have to worry about catching the virus from the surfaces. But of course, as you said, it's still potentially airborne and kids can spread it. So, do we come up with a system of, half the school comes on one day and half the school comes on the other day so that you can maintain social distancing? I really don't know. And I don't know that the data's out there to really kind of make that decision yet. So I really think that the educators and the state and local governments, and certainly the Department of Education, needs to be looking at this to say, well, how can we do this safely? And how can we do this? Because our kids need to be educated and they need to go back to school, not just for their own education, but as a parent, our own sanity. I think everybody would agree with that. But also, you have a job. Most parents have jobs and they can't sit at home all the time. So it's a big problem. And I really think that we need more information and more research, but it can be done safely. And we just got to figure out how.
Dr. Ron Elfin Bane, I absolutely hear you on wanting to get those kids back to school for our own sanity, but also for all the parents who are trying to juggle working and educating their kids. So let's hope that people are able to figure it out. Thank you for joining us.
Thank you so much. Have a good day. Stay safe.